Hi, it's Crystal. Today I'm going to be reviewing a case study about Stacy Smith, who is a 13-year-old African-American female girl who is complaining of fatigue and weakness. She lives with her mother in a small apartment, and she mentions that her mother works a lot to make ends meet. She says that they eat mostly processed, cheaper foods. Stacy has no medical history or current medications. However, she did say that she started her first menses last month and fainted while at school. So I'm going to be directing Stacy. So Stacy, thank you so much for coming to see us at the clinic today. I'm sorry that you're feeling bad. I believe that what you are experiencing is called Iron Deficiency Anemia. Iron Deficiency Anemia, also known as IDA, we'll call it that for short, is the most common type of nutritional disorder, and it is very common in the United States, especially in toddlers, adolescents, girls your age, and women of childbearing age. As the name implies, your body is deficient in iron. By not having enough iron in your blood, in your body, your red blood cells cannot produce enough hemoglobin for your body's demands, and this leaves you feeling weak and tired. There are many causes of IDA, and some of them are blood loss, lack of iron in your diet, and the inability to absorb iron, and then also pregnancy. And you can fall into two of these categories as to why you're feeling bad. That would be blood loss because you did just start your period, and the lack of blood that you have during that time can make you anemic, and also that you probably lack some iron in your diet. Teenage girls that come in are mainly due to rapid growth combined with the inadequate dietary intake of iron, and then increased by the menstrual blood is the most common reason for IDA in teenagers. And the highest risk population for developing IDA is African American females living in poverty. I know that your mom works a lot and you guys tend to have quick, cheap, easy meals, so that both of that can contribute to the issue. So sometimes for symptoms you may not experience anything, but you've already said that you're kind of feeling weak and tired and that you had passed out. As the iron deficiency increases in severity, so do your symptoms. Common symptoms include extreme fatigue or tiredness, weakness, pale skin, chest pain, fast heartbeat or shortness of breath, headache, dizziness or lightheadedness, cold hands or feet, inflammation or soreness of your tongue, brittle nails, unusual cravings such as ice, dirt, or starch, and having a poor appetite. Like I said, nutrition plays an important role in IDA. People who have poor diets that are high in junk food and processed foods are higher at risk for developing this type of anemia. And like we said, I see that you tend to eat a lot of processed foods, and processed foods are not usually high in good nutritional content, but full of fillers. I would like you to be able to increase your foods that are rich in iron or fortified with iron. And some ways that you can do that is by adding in red meat, pork, poultry, seafood, green leafy vegetables like spinach, peas, raisins, dried fruits like apricots, and fortified cereals, breads, and different kinds of pasta. These foods will help increase your iron. And also, if you can try to supplement your diet with foods that are rich in vitamin C, because vitamin C helps the absorption of iron, so it'll help you obtain it better. Examples of vitamin C rich foods include kiwi, oranges, strawberries, melons, and broccoli. I would also like, while we're here, to do a few labs. I would like to check your CBC, which is a complete blood count to look at your hemoglobin and hematocrit, a serum iron, ferritin, and transferrin level, and also to get a small occult stool sample to make sure that you don't have any internally bleeding that we would need to be concerned with. During this visit too, we'll also be getting a set of vital signs, get your weight, and I would like to do a thorough cardiovascular and respiratory and neurological assessment. For treating this, along with changing your diet, I would like to add in oral iron supplement, just a little tablet of 325 milligrams per day, because this is the suggested dose for any menstruating females. And if this anemia is severe enough where you would need to be hospitalized, a blood transfusion may be required. We'll know that when we get your labs back, and by your symptoms, I don't think that you'll need that at this time. Also, if you continue to have heavy periods and feel really awful during those times, we can also consider doing an oral contraceptive to help decrease the flow of your periods. But let's see if this iron supplement helps first. And some education about taking iron. Just try to take your iron on an empty stomach if you can. But if it does cause some tummy upset, that's normal. You can go ahead and take it with food. Also, if you can, take your iron supplement with a glass of orange juice, because again, it's got high vitamin C that's going to help increase your absorption of that iron. And if you can't get orange juice, we can add in a vitamin C supplement. Also, drink a lot of water to stay hydrated. Sometimes taking iron can cause constipation, and that's normal. If increasing your water doesn't help with that, see if we can add a stool softener, an over-the-counter stool softener to help with that. Also know that your stools may turn black, and this is a common side effect from taking iron. It may take a few weeks to months to achieve a healthy iron level. So I would like you to make a journal of your food intake and your monthly cycles and your symptoms. And we would like to see you in 1 month in the clinic for a follow-up and redraw of your labs, and also to please call the clinic or come to the ER if you have any signs of heavy bleeding, difficulty breathing, changes in your heartbeat, or if you have any other questions for me. Thank you so much.